Hey everyone, in this video we are going to discuss some of the maternal changes that occur during pregnancy, and they begin, as we discussed earlier, with the secretion of HCG. This is going to maintain the corpus luteum, which is going to secrete estrogen and progesterone to inhibit FSH and LH to stop the reproductive cycles. Long story short, if you have HCG, we are going to keep the corpus luteum. And if we have the corpus luteum, we can secrete these hormones, estrogen and progesterone, which will prevent FSH and LH from continuing with the reproductive cycle, meaning it'll stop the body from rejecting the embryo and removing it from the body. These HCG levels are only high for the first 2 months and then decline because the placenta is going to begin to take over the production of estrogen and progesterone. So once the placenta is ready, it will start to take over that role. Once established, the placenta secretes large amounts of placental estrogen and progesterone, which will maintain that uterine lining. And these estrogens and progesterone, again, will inhibit FSH and LH, and therefore inhibit uterine contractions. Therefore, it will not reject or remove the embryo. It will also enlarge the reproductive organs. And again, this all makes sense because the last thing you want to do is remove the embryo when it was already implanted, right? We want to continue fertilization and maturation of that fetus. So it makes sense that all this would happen. The next up, placental lactogen. This is going to stimulate breast and mammary gland development. So the breasts will continue to develop to prepare to create milk in the future. We are also going to see relaxin from the corpus luteum in the placenta. It will inhibit uterine contractions. Again, that's important. We don't want to remove this embryo. And this will also begin to relax the pelvic ligaments to allow for that baby to continue to grow inside the mother. Aldosterone will also be released in order to promote sodium and water retention because, again, we want to make sure that this baby has enough of water as well as blood, which the mother is going to be creating, as well as the correct electrolytes that they need for healthy neuron development and function. We'll also see the parathyroid hormone maintain calcium concentrations in the maternal blood for the developing baby. This image is just showing from start to finish how the trophoblasts will begin to secrete the HCG, which will maintain the corpus luteum, which then will secrete the estrogen and progesterone, which is needed to promote the growth and development and maintenance of the uterine wall. So it's interesting to see how these hormones are going to be used to maintain the uterine wall and not continue through the regular monthly cycle. Here's an image of the hormone concentrations and how they change throughout the pregnancy. You can see HCG is extremely high for the first 2 months and then plummets, whereas estrogen and progesterone continue to elevate throughout the pregnancy. Here's an image that discusses pretty much everything we already talked about, but again, it outlines everything in a nice, concise way. And then lastly, we can discuss how, as time moves on and as the fetus continues to grow, the uterus is going to displace or move the abdominal organs. So because of that, just think about it. You have a baby growing inside the mother. All of the organs inside of the abdomen where this baby is growing are going to get shifted and moved out of the way to make room for the baby. So some things that will happen. The stomach's a big one. The stomach gets smaller because the baby's pressing on the stomach. So the mother is going to have to eat smaller meals. And this can also cause heartburn because it'll push on the stomach and the acid will get pushed up through the cardiac sphincter and into the esophagus. We'll also see that the fetus is going to push on the urinary bladder and increase urination. As the fetus grows, more oxygen is needed and more waste is excreted. So, because of that, this is going to cause the maternal increase in blood volume and cardiac output, as well as breathing rate and urine production. So, not only does the baby need more oxygen and nutrients, and is it removing more waste products, but because the mom is the barrier between the two, the mom is going to have to do everything even more. She's going to have more blood, she's going to have a higher heart rate, higher breathing rate, also potentially higher blood pressure, as well as more urine. So, not only are they urinating more frequently, but there's more urine to excrete. To obtain adequate nutrition, food intake must be increased to supply the needed vitamins and minerals, as well as proteins for the mother and fetus. In case of an inadequate diet, the maternal body will suffer nutrient deficiencies before the fetus, because the fetus is taking everything first. If you have any questions on maternal changes during pregnancy, please let me know.